usually, ano mo yan siya masyado.
You cut them into small pieces, no?
Para lahat talaga, kasi ano siya, hindi na niya kaya mag-swallow ng matitigas. So, tiyaga lang talaga na, tiyaga lang, isang oras siguro magpakain pag ganito ng katanda, mga isang oras ang allotted time para magpakain ka na mabusog siya, maubos-ubos yung ano niya.
And of course, except for those with special prescribed diets, no? But my mother has no diabetes, no nothing. She has mild hypertension, so maybe in her case, there's a little bit of controlled salt. Maybe it's not too salty, right? Because of the hypertension. But other than that, carbohydrate is okay, right? On a moderate amount. So, how do you motivate, say a patient who has no appetite eating? How do you, what is the way to encourage them to eat?
Usually, pag ayaw niyang kumain, tinatanong namin kung anong gusto mong kainin, kasi kung binibigay namin yung, yan munang prutas, sige, bigyan namin yan.
So parang may variation ng approach, no?
Usually, ganito, unahin namin yung mga cereals or ano. Pero kung ayaw niya, wala akong gana ngayon, anong gusto mo dito, anong ituro niya, yan lang muna, yun lang din ang binibigay namin. Tapos, after an hour or after a minute, parang gusto na naman niya, pang-abrigahan na ng
So parang meron pang kind of an appetizer, no? Kung baga sa restaurant, appetizer. Pero napapansin ko, you always have the television on. No? Bakit? Anong purpose why the television is always on while you feed the patient?
Kasi kung may TV kasi, usually si Lola, yung parang hindi lang niya napapansin na kumakain siya.
Okay.
Tapos nag-i-enjoy siya, hindi siya matutulog.
So
Kung
that's
walang television,
another technique, ha?
kung walang television kasi natutulog si Lola, matulog siya, matulog siya, magkain. Pero kung nanood siya, so hindi niya napapansin, naubos na pala namin yung lahat ng kinakain.
That's good. So that's a tip to other caregivers, no? That there are special techniques that you should employ, especially in taking care of an elderly. And what about how do you communicate? Like say an elderly patient like my mother, who there are times she doesn't talk a lot. How do you do things like that?
Si Lola naman, dapat ang pasyente mo, alam mo kung ano siya before, anong hobby niya, anong gusto niya. Si Lola naman, gusto niya magtahi. So tinatanong, gusto ka ba magtahi ngayon?
So parang bringing back the memories,
niya,
no?
ay, pagod ako, tapos minsan, gusto. Parang, may magkuha ng tahi mo na, yung tinatahi mo na, may magkuha na. Sabi niya, hindi ko pa natapos. Parang gano'n, parang may ma-remember din siya.
Yeah, kasi there are even patients na meron talaga silang Alzheimer's. In her case, she doesn't have Alzheimer's.
Pero maano niya yung before niya.
It might be harder if you are dealing with Alzheimer's patient, no? Where totally, the patient cannot relate to what you're doing, cannot even communicate. So, some more tips to our average caregiver who will like to be as good as you are.
Pag caregiver ka kasi, lagyan mo lang ng puso. Kasi kung hindi mo mahal ang pasyente mo, kahit anong gawin mo, parang mapagod ka, yung napapagod ka din. Pero kung mahal mo yung pasyente mo, hindi mo maramdaman na napagod ka na.
Kasi napapansin ko here in the Philippines, a lot of women especially, or some men, no, they have a degree in accounting or in engineering, and then they thought that there's a potential for them to go out of the country by becoming a caregiver, no. So they enroll in a regular caregiving course. How long would this take them?
6 months.
6 months. So, but then some of them, after getting the certificate, they don't move forward, no. They just get the certificate, and then they are not even able to do the actual caregiving, and it ends up like they just wasted the 6 months and the money they spent for the training. So why is it like that?
Ang iba, siguro hindi nila kaya. Actually, ang ambition lang talaga ng mga tao, kaya kumukuha ng caregiver kasi in demand sa abroad. Tapos kung dito sa Philippines, siguro hindi masyadong mahal ang bayad. Tapos hindi pala nila kaya yung...
So wala silang hands-on. So,
Tapos,
after nung course, wala nang follow-through na parang actual experience talaga.
tapos
And maybe there are not too many families who can afford really to pay a caregiver.
Dito, only rich. Hindi talaga, wala talaga. Sa Philippines naman...
So ang yung balita ko, because the Canadian government or Canada in general, they need caregivers. But the thing is, if they hire directly caregivers from the Philippines and they go through the process of interviewing, they fail along the way, when they are being questioned about actual scenarios, they don't really meet the standards. So what happens now is, the Filipinos who will have a chance to be caregivers in Canada are those Filipinos who already work in Hong Kong and Singapore, because over there they're able to really do the actual caregiving work. So, but in your case, Ta, I know this is not the first time that you did this kind of work. How long have you been a caregiver?
Last year, 1 year.
So,
Meron
1
akong
year.
pasyente na cancer sa brain, 86 years old.
And you took care of her for how long?
1 year.
1 year talaga. So, wow.
1 year, straight 1 year.
And why did the patient last for that long under your care?
Prolong. Usually talaga, pag caregiver, ang intention mo na prolong the life, to prolong the...
Your job.
your job.
Okay.
Prolong. Gawin mo lahat para ma-prolong. Kasi kung mamatay, di...
Yeah. So, hopefully, we were able to send a message across to our viewers and to somehow educate those who are in the field of caregiving. As Tata said, to put your hearts and minds in the profession. To me, caregiving is a special field nowadays. They are not nurses, they are not doctors, they are not housemaids, but they have the special skills, they have the special training. They are professionals in a way, because they work part of the roles of the nurses. They work also some of the roles of the physical therapists. They work as a nutritionist, and sometimes they also work like a doctor somehow, right? So, parang package as one. So, once again, I would like to express my sincere thanks for really seriously and sincerely taking care of my mother, and I admire your expertise. Hopefully, you will go. You will go places. I would highly recommend you in the future, in the event that you would like to work abroad. I will personally make a good recommendation letter so that some other people, outside of this country can feel the love and care that you are giving to patients like my mother. Okay, so thank you very much.
Cauliflower, vegetables.
If you give some every day, if you take some time to pay, you will know the world's alright when you close your eyes at night. Reach out If